Get rid of neck pain from sleeping wrong. A locked up neck from sleeping can ruin your week, but we can help. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and if you know of anyone that wakes up regularly with a locked up neck and they can't move very well, I want you to share this video with them right now. Now, it's unfortunate, but let's face it, the older we get, the more likely we are to wake up with a neck that hurts in a way that most of us would consider inappropriate, to say the least. Not only that, but you can hardly move your head or your neck in one direction or the other, and it's beyond painful. It's absolutely miserable. If you're going to be in pain on that level, now wouldn't you at least like to have done something to earn it? But no, you just went to sleep and you woke up that way. It doesn't seem very fair, right? So now what? I mean, should you go to the emergency room? Maybe the urgent care? Maybe you go to your family doctor? Or what about maybe the chiropractor? What's the best course of action when something like this is happening to you? Well, let's talk about what commonly causes something like this first. Without getting too technical and losing you here on this video, I'm going to say that you have cartilage in the facet joints in your neck. Now, those are the joints that stack up on top of each other in the spine. They're just behind the spinal cord. And when we're in one position for a really long time overnight, especially in a position that is at the extent of our range of motion, well, those folds in those facet joints, well, they can kind of unfold to an extent. And when I say to the extent of your range of motion, I'm talking about maybe having the head turned all of the ways to one side or the other and laying like that for a long time while you're sleeping. This is common with stomach sleepers because when they lay down, they've got their head turned all the way to the side with their head like this, and they stay in that position for a long time. So when these cartilage folds kind of move around a little bit, the medical term for that is called either entrapped or extrapped, depending on how these folds unfold. But that stuff doesn't matter. What matters is that it hurts, and it hurts a lot, and now your day is getting messed with. That's what's important. Now here's the excellent news. This pain responds really well to spinal manipulative therapy, which is what chiropractors are most known for. This pain is caused by how joints are or are not moving together. So in essence, it's a movement-related pain. I'm here to tell you, movement-related pain responds better to movement-related treatment like spinal manipulative therapy. Much better than it will respond to chemical treatment. And chemical treatments are like pills, muscle relaxers, cortisone shots, things like that. Those don't fix the issue. They just fix the symptom of the issue. So chemical treatments, they're just not as effective for movement-related problems for obvious reasons. Now, these folds that have unfolded are somewhat quick to go back to their original shape and intent once we kind of encourage them and help them through a few trips to a chiropractor that, let's say a chiropractor that knows what's going on, recognizes what's happening, and knows how to help. Now, once we've gently treated the area, we will use a technique called restrictive range of motion to start increasing the range of motion in the neck and get the patient functioning better and moving better than when they first showed up at the clinic. Then we'll provide some at-home exercises to make sure that they can continue the improvement once they return to the house. So, if I woke up one morning unable to turn my head or even get comfortable, I would first do a bit of a self-assessment to try to determine whether there is any kind of emergency going on, right? We typically have a sense of whether or not it's just musculoskeletal or if something bigger is going on. And there is almost never something bigger going on, by the way, so don't get all scared. But once you determine there's probably no emergency, I would go directly to the chiropractor and be evaluated. Don't pass go, don't collect $200, just go there and have them help you get back on the pain-free path. Now, if you're from Texas Panhandle or you're going to be traveling through and you need to be evaluated and treated, please feel free to call us at 806-355-3000 and let's get you on our schedule and let's help you out. If you're watching us on Facebook or YouTube, hit that subscribe, like, comment, and then share this video, won't you? It all really helps us to get our message to as many people as possible. Thanks, and we'll see you again next week.